Well, we're back, and in this set of video lectures, we'll be talking about coding other disorders of the eye. Some of these cross over to other chapters, and let's take a look at some of those, starting with retinopathy. And again, we can have other disorders of the retina, the retinopathy of prematurity falling into the code subcategory of H35. And again, this is a vasoproliferative disorder that happens to the developing retina that you see in premature infants that weigh less than 3 pounds typically and less than 31 weeks. It can either be mild or severe. It can affect usually in both eyes, although there are codes for left and right. Another common eye disorder that we have is glaucoma. That basically is a group of disorders that talk about the damage to the optic nerve. This is a result of increased intraocular pressures. So in these types of glaucomas, the fluid isn't draining out of the eye as it should, so it builds up in the anterior chamber and provides pressure to the optic nerve, and that's where you get the visual impairment. It can be described as open angle, primary open angle, and others. And anything that we do, this is the puff test that they do. So patients are at higher risk due to age, other factors. Sometimes we don't have damage to the optic nerve, but you'll see terms that have suspect, suspected. Those are entirely different conditions, so please be careful as you go through these. And then another thing when you're looking at glaucoma is you have to pay special attention for the terms surrounding the main term glaucoma. Glaucoma can be described as open angle, where the angle between the iris and the cornea is open, but the draining system isn't working. And then we can have primary closed angle glaucoma, which is the acute form, right? In other words, the angle between the iris and the cornea, instead of being open as an open angle, it's closed. So then the other humor, the aqueous humor, is not draining. So the pressure remains raised in the anterior chamber. So a couple things to look at when you look at these glaucoma documents. Look to see if it's angle, and again, acute. Usually it's going to be this, can be chronic, can be intermittent, can be open, can be closed. So important to get your mind around those. And if you're not clear on what these things are, a medical dictionary is a very useful reference. And like retinopathy, where it can be secondary to diabetes or prematurity or what have you, we can have glaucoma developing as a manifestation of another disease. This can include eye trauma, eye inflammation, some medications, and you'll see that there'll be very detailed instructions to use additional code that will show up beneath the code subcategory. For instance, use additional code will appear beneath the subcategory H40.6 to code the drug that's causing the adverse effect of glaucoma. Right. So very important as always to read the tabular, not only to get left, right, bilateral, unspecified, but to get all these other things, whether the medication's causing it and what have you. Aqueous misdirection is a term that we see, and this is also known as malignant glaucoma. It's not malignant in terms of cancer, it's just meaning that it's severe and progressive. Usually this is a result of some sort of traumatic blow to the eye, sometimes complications of previous eye surgery, right? And it's not closed angle or open angle glaucoma. And then finally, we have intraoperative and post-procedural complications and disorders of the eye, and not elsewhere classified. And these could be complications due to cataract surgery and so on. Look for the main term complications, might be a good place to start, and then you can go on from there. And that's all I have for you. We will see you online.